Hi, welcome to Sparkling Memories, a place where you can build healthy relationship with food pairs and yourself. And today we're going to talk about fibroids, a minimal invasive procedure that can use to treat fibroids. Is it painful? Do you have your cycle afterwards? Why would you even choose this procedure versus something else like a hysterectomy or myomectomy? Versus, is it worth it if you want to have children, or if you don't want to have children, should you still get the procedure? Now, let's start with the simple basic stuff. What is fibroids? Fibroids is basically growth that's in a woman's uterus. There are several different areas it can be. It could be in the walls, it could be inside the uterus, it could be along where the ovaries are. A lot of the times it's there by the uterus because they call it urinary fibroids. The growth within the woman's uterus. You can get it at any age. Some people get it as far as way back, like from time they're like 18 to the time they first get a first cycle. They grow within your body. A lot of the times it's African American women or black women that tend to have urinary fibroids and fibroids in general versus the other races. A lot of times it's more predominant when it comes to African American females. Now, they have a minimum invasive procedure that is in and out. Basically, you're there for at least a half an hour, and then the actual procedure, it could be anywhere from an hour to an hour and a half. There's no overnight stay, and you could actually have visitors if you're going to have the procedure done because a lot of the times they don't want you to do too many things that are very invasive, like driving, getting on a plane, do something that may require you to do other things besides relaxing, basically. So a lot of times women have urinary fibroids and depending on location, it might not affect their cycle and other have multiples in different sections in the uterus that actually affects their cycle, their mood, the eating habits, the way they look in their clothes. It affects their fertility. One of the main reasons I want to talk about UFE, and I also have another one that's called urinary artery embolization, and then there's urinary fibroembolization. In a minimal invasive surgery, which means you take it from where it's at and cut off the blood supply, and hopefully it causes them to shrink because it's like you have something in the center, and then there's different veins and different pathways that do the blood, and it flows to the fibroids, and the fibroids like grow, and some of them they have like different bunches, different areas. So it depends on what type of fibroids, because as I understand, there are four different types, and the location is varies. You could have it in different locations and different number in terms of how many you have in your system. Now, hysterectomy is basically you removing a woman's uterus. You take away her womanhood. She's no longer able to carry a child because there's no uterus to utilize a safe home for baby. Now, a myomectomy is basically you going into, I do a like a C-section cut, you would say, and you literally moving the fibroids from the lady system, and then they put in sewing it back together, and then you have this scar where they went in and they took them out. Now, this one is UFE, urinary fiber embolization. It's basically a cut. You could either have it in your arms, your artery, and you have one you could have a little bit more by your leg area, and then make a small incision and have a little tube that goes up and it goes to the artery where it puts different particles inside and it would block the blood supply to the fibroid. Now the sizes of the fibroids, some of them might look like banana shape, some of them might be like a melon, some of them might be like a watermelon, some might be as small as like a pea or peas. very tiny. Some that might look like grapes. So they come in different sizes and different areas. Now, as far as when it comes to after procedure, you might have some type of cramping. It typically feels like when a lady is about to have her menstrual cycle, those cramps. To make it any more clearer when I say cramps, it should be not as bad. Some women experience bleeding, but not a heavy flow like a cycle. It might be light bleeding and it might happen for a few days. Others, there's just the cramping without the bleeding. So it depends on the lady and where hers were and the length of time because some people are slim and they see the tummy area go down really quickly because there's not a lot of fat going on there and from time it starts to shrink after a few days, weeks, then you might see the difference in her tummy when I say right away. Other people might have larger ones and the location might take a little longer for the shrinkage to start and for it to gradually turn into a different size or may disappear altogether. Now, as far as the complication, yes, there are complications, but that varies from the particular woman in terms of her size, location, if she will have complications. But it is very rare, which is the great thing. Now, when it comes to this, a typical don't cause you to gain weight, it won't cause you to lose it. Will you still have a cycle? Yes, you still have a cycle, but because of the procedure, it might be a little lighter for you. Others say it didn't help at all. Now, it may vary, depends on where you go and what they do, but it's supposed to be the similar when it comes to all the all the logistics when it comes to actually making the procedure and doing it to the particular lady to get it done. Now, as far as a woman's body, when it comes to a woman's body, the tummy area tends to be like really bigger in size. Sometimes the lady can look anywhere from 3 months to about 6 months pregnant because of the location of the fibroid, and then it would cause the lady abdomen to expand and her tummy looks a lot more bigger in size and might even take on a weird shape for some. Because some people are slim and then they get a little pooch, and then other people it look like they carrying a kid, like they're literally pregnant. And it comes with different symptoms because some of the symptoms are very similar to a lady that's actually pregnant. From the cravings, the eating of ice, the tiredness, it mimics pregnancy, but it's not actually that pregnancy, if that makes any sense. There are tumors in there, but it's not actual pregnancy because it's not a human being that's about to become, a baby. It is not that. It's actually the tumors. Now, as far as when it comes to that, when it happens to someone who wants to have the UFE, is someone who wants to have children. You could be about older age, 45 and older, and have the procedure done, even though you might not want kids, but you want to keep your uterus and you want less time to recover so you can go back to work and what you're doing. Then you might want to consider having a urinary fibroid embolization or a urinary artery embolization. If you prefer to do something that's not going to take a long time in terms of the recovery, the procedure, and the results, then you might want to consider doing this procedure. Till next time, we will see around for sparkling memories. Bye bye.